So now we will discuss the instruments which are used during the procedure of anterior nasal packing. This 4% xylocaine is used to soak small ribbon packs or cotton pledgets, and those small ribbon packs and pledgets are inserted into the nasal cavity for 15 minutes to half an hour to make the patient nose anesthetized. After local anesthesia with this 4% xylocaine solution, we will remove the xylocaine packs with the help of this packing forceps. This is nasal packing forceps, and with the help of this nasal packing forceps, we will also insert the nasal pack. Use this xylometazoline nasal solution. This xylometazoline nasal solution is used to cause vasoconstriction of the nasal mucosa, as well as it can also cause vasoconstriction of blood vessels. So this is xylometazoline solution. This is also used to vasoconstrict the nasal mucosa and the blood vessels. Okay. Now, after local anesthesia and vasoconstriction, we will have to examine the nose of the patient for the bleeding or for the bleeder with the help of this thoracic nasal speculum. Different sizes of nasal speculum and different types of nasal speculum are used to inspect the nasal cavity of the patient and to locate the bleeder. We will hold the nasal speculum in the same manner with the left hand. Index finger would be placed between the nasal speculum. Flexor surface of this middle finger will press this, and the extensor surface of the ring finger will press it like this, and we will grasp the nasal speculum like this, and we will put our thumb over the nasal speculum. Then we will insert the nasal speculum into the nasal cavity of the patient, and we will release the pressure to inspect the nasal cavity for any bleeder. For mostly the nasal bleeders lie anteriorly at Little's area or the area of Caselbeck's plexus, where there is confluence of different vessels which are very prone to bleed due to trauma, hypertension, blood disorders, or any other condition. So we will use this nasal speculum to inspect the nose and nasal cavity, and this we will put it in our left hand. We will also use headlight to throw light in the nasal cavity of the patient. So after inspection, what we will do, we will start nasal packing, and the nasal pack we will insert. The width of the nasal pack would be half an inch or 1.25 centimeter, and this nasal pack is also known as ribbon pack or ribbon gauze. Antibiotic cream to lubricate the nasal pack, and this bismuth iodoform paraffin paste. This paste is also applied on the ribbon gauze if you want to keep the nasal pack for a longer period. So this is bismuth iodoform paraffin paste, and this nasal pack will be soaked either in this antibiotic cream or bismuth iodoform paraffin paste. If you want to keep the pack for a longer time, you will soak the pack with this BIP, or if you want to keep the pack for 24 hours or 48 hours or so, you will soak the pack with this antibiotic cream. Okay. Now, as I told you that this is nasal packing forceps. Nasal packing forceps are used to apply or use nasal packing forceps or Tilly's forceps are used to hold the nasal pack. Suppose this is ribbon gauze or nasal pack, we will hold the pack with this Tilly's forceps in our right hand, and in our left hand we will take this nasal speculum. First we will insert the nasal speculum and then we will release it to dilate or to retract the nasal cavity. Then we will hold the nasal pack at some 4 to 6 inches away from the end, and then we will push the nasal pack in the floor posteriorly, and then after pushing it posteriorly we will take other layer of this nasal pack and then we will put it posteriorly like this and like this. That means the nasal pack or the ribbon gauze will be inserted in a zigzag method. Our headlight will illuminate the area, and then nasal speculum will retract the nasal cavity and the nasal packing forceps will insert the nasal pack into the nasal cavities. So these are some instruments and materials used for anterior nasal packing. These nasal packing forceps or Tilly's forceps are also used to remove the nasal packs. Kidney tray and bowels are also needed for the purpose of nasal packing, that is anterior nasal packing. So this is a suction nozzle. This suction nozzle is attached to the suction pipe and that will finally go into the suction machine, and you may need or you will need to suck the blood from the nasal cavities during the procedure. So to clean the nasal cavity, this suction nozzle is also used, and again you will retract the nasal cavity with the thoracic nasal speculum, and then you will suck the nasal cavity with this suction tip or suction nozzle. Finally, when you pack the nasal cavity or when the packing is completed, then you will put this piece of gauze just in front of the nostrils, and then you will apply paper tape over the nasal pack. So you will finally apply these tapes. The size of this tape is a little small. You can use paper tape of a longer length, and then you will apply the paper tape over the nose of the patient after putting this gauze in front of the nostril. This is how you complete the procedure of anterior nasal packing.